Which of the following diseases is most likely to be associated with the patient's presentation? A 32-year-old man presents to the ophthalmology clinic with blurry vision in his left eye. He denies any pain, redness, or history of trauma. His past medical history is unremarkable. On examination, the pupils are equal in size, but a swinging flashlight test reveals an abnormal response. When the light is swung from right eye to left eye, the left pupil dilates. So let's see the answer choices. I don't think it would be retinal detachment because of his lack of history of like trauma. He also has no like hypertension. So I would probably rule out, or any history of diabetes or anything like that. So I would rule out central renal artery occlusion. Optic neuritis. Um, I do associate, let's see, acute angle closure glaucoma. I would also associate with some form of like maybe papilledema. Retinitis pigmentosa and optic neuritis would be the last two choices.
Okay.
And I would probably narrow it down to optic neuritis due to the presentation, but yeah,
Okay, final answer.
yes.
Okay, good. Um, Unremarkable, right? So the key thing is like one of his, blurry vision on one eye and abnormal to, the afferent pupillary defect, right? Optic neuritis, which is inflammation of the nerve, right? That can cause vision loss. It's associated with multiple sclerosis, which we didn't see, but it can also occur in isolation here. But what is the main thing here? The main thing is this physical exam finding, right?
Yes.
And why it's so important is if you take a look at it, right? Because when you see light, both pupils should be able to respond, right? Like for instance, if I blocked one eye off, right, and kind of shine light in the right eye, both should constrict, right, to prevent light from getting in, right? But when it went from the right to the left, the pupil dilates on the left, meaning it can't sense light very well. Does it make sense? So you know that it has to be a neurologic issue causing, right, an issue with that pupillary, right, afferent pupillary defect.
Yes.
Okay? So A would be your best answer.
Mhm.
Okay. Questions about that?
No.